Shadow Minister, Dr. Luke Evans.
Thank you, Mr. Rosendahl. It's a pleasure to serve under your chairmanship. And for me, this is the first day in the brief, and it seems prophetic to be taking this brief over and being in a debate on respiratory illness, considering it was my first ward job as a junior doctor. I worked for 4 months in A&E in the West Midlands, and then my first ward job was doing respiratory in Solihull Hospital. So I've seen up front just how important respiratory medicine really is. And I'd like to put on record my thanks to the member for Strangford for securing this debate. Now, he may often get called last in the chamber, but he's clearly got a trick on how to get debates called so successfully. So I'm looking forward to maybe having a cup of tea with him to understand how he can be so successful in getting debates called. If I can turn to the contributions from the debate so far, to the member from Newcastle-under-Lyme, it's both a blessing and a curse to hear this same argument made by his predecessor about the quality of air in his constituency, and the fact that I gather it's a tip that causes a huge amount of problems there. I hope he has success in getting this sorted. I hope he takes some comfort that the last government did enact the Environmental Act to make sure that legal limits are put in place to try and help air quality and, of course, offer air quality grants. But there is clearly at East Midlands, West Midlands interest in respiratory here with his colleague who's now no longer in his place. Me, having worked over in the West Midlands, now transferred to clearly the better East Midlands and making a representation from here, of course.
Well, I'm very grateful, Mr. Rosendahl, to the Shadow Minister. I will gently push back on this narrative that the previous government made this sort of progress in tackling the issues at Wally's Quarry that he has just implied. My constituents continue on a daily basis to deal with the worst effects of the hydrogen sulfide levels emitting from that site. And hydrogen sulfide is a heavy gas. There's schools around there. The impact on our children and young respiratory health on young lungs is massively underrated and fails to be part of the conversation. So what I'd like to do, Mr. Rosendahl, is invite the Shadow Minister to come to Wally's Quarry and to Newcastle-on-Lyme to smell for himself.
I'm very grateful to the offer. If there's a cup of tea, it may well be a consideration to have too. Maybe we could take all of us as a group cross-party trip from this debate to be there. I'm happy to give way again.
Thank you. Rather than have a cup of tea, because there's been quite a lot of sobriety in this debate, I'll take him to the Wagon and Horses pub in Newcastle-on-Lyme for a slightly cold refreshment.
I'm very grateful for the offer. From there, turning to the member from Blaydon and Conisset, can I congratulate her for her work in the APPGs? And of course, number one, she is right to highlight smoking as a big problem. And the health inequalities as well is so important. And that leads on to the access. We know people with health inequalities also struggle to generally access healthcare, let alone for respiratory conditions. And we haven't even gone into talking about the equipment and the expertise that you need in this area to deal with that. To the member from Sherwood Forest, pulmonary fibrosis. Really important condition, not given the precedent it deserves and how debilitating it is for patients who suffer with this. So may I give her a special tribute for raising up so powerfully, so emotionally, and she's a true champion for doing something for a condition that is not thought about nearly enough. Turning to the member from Winchester, he's absolutely right with his holistic approach, and it's outside of the remit of this debate, but of course housing, environment, smoking, as we mentioned, all play a big factor. We haven't even talked about comorbidities yet. We usually know that people over the age of 60 are usually on several medications, may have heart problems as well, may have musculoskeletal problems. This is going to cause a really big impact. With regards to him being a vet, I think I'm still right in being correct, is that he is allowed to practice on humans, while I certainly am not allowed to practice on pets. Now, this is not for a debate today, but something that I think is, if there is a problem, you should rush to him too. And his point about antimicrobial resistance is really interwoven into everything here, because actually there is a danger that overprescribing prescriptions for chest infections when they turn out to be viruses is a really problematic issue that is growing and is the next probable big pandemic with no easy solution. So he's right to highlight that. Turning towards the APPG, may I thank them for all the work they do, led by the member for Strangford. It's really important to be able to get a debate and raise these issues and to have the infrastructure behind the member to support the team in dealing and producing updates here. And when it comes to respiratory medicine myself, I actually have a personal history, having ended up on the intensive care unit with bilateral pneumonia after an appendectomy in my late 20s. It's left me under, at previous times, at the brittle asthma clinic. And I myself had many attempts to diagnose what was going on, but nothing ever found, but had to be treated with repeated steroids, and have felt full on what it's like to suddenly not be able to breathe, not be able to exercise, and have that taken away from you. And I think listening to what's this debate, the key one for the public to realise is just how important your breathing really is. And a breathing condition is so seminal in everything you do. There's a reason why you come to an emergency, it's an A, B, C, D, E, airway, breathing, circulation, because breathing is quite literally life. And having that taken away from you, as many people have experienced to a little bit by getting COVID, has at least made people aware of just how bad viral illnesses can really be. Turning to some of the other conditions that we haven't talked about, I feel like I'm being back in one of my medical exams in the 5th year, because we've heard talking about asthma, COPD, but we haven't talked about pulmonary embolysis, pneumoconiosis, TB. We did hear about cystic fibrosis, but we haven't heard about mesothelioma, sarcoidosis, and pneumonia is a really important one to talk about too. And finally, lung cancer. These conditions, there's probably some I've missed as well, are really important, but make up that third place for all deaths, and respiratory conditions therefore need that attention. So I was pleased to see that the government, the last government, did come forward with the community diagnostic centres, 170 community diagnostic centres going up across the country to get better access, be it MRI scans, CT scans, blood tests. These are going to be really important. And I myself in Hinckley were lucky to have a £24 million investment of a CDC there, which will have MRIs, CT scans, and it's being built as we speak. So that will really be transformative for my community when they're caught between two big centres going towards Nuneaton and Leicester. I hope that means that when we look forward, that when it comes to the hospital rebuild programmes and the current review that's going on, this respiratory conditions will play an important part in making sure we have the apparatus and equipment to be supportive for there. If we turn into the nitty-gritty of the debate, I entirely agree with the idea of prevention. And so this side of the House brought forward measures to deal with smoking, and I hope to be seeing, as the government steps forward with its further ideas of how to deal with smoking and push for a smoke-free generation, we'll be looking at that very closely. The member for Strangford really hit on a point about data. Most health policy must be driven with decent data. And I think the APG works highlights how the respiratory conditions tend to fall behind on that. So questions to the Minister about what work is being done on how we can join up that data set, not only from simple things of how we record things, but also in my constituency, for example, we have two boundaries we call between North Warwickshire and Leicestershire. And to get some of the answers to the tests, an asthmatic doesn't have an asthmatic an asthma attack, directly where they live. They could be on holiday, yet sharing that information of what's happened, what treatment, what investigations have all been done is really important. And that leads me on to the next question. We heard it about spirometry being raised. Spirometry is really key, and it's too sporadic about where it is and how to achieve, plus the skill set to be able to deliver spirometry. And then, of course, we have pheno when it comes to asthma as well, fractional inhaled nitric oxide, which can help aid the diagnosis of asthma. This is going to be really key, and I'll be looking forward, in this side of the House, we'll be looking forward to seeing what the new BTS guidelines worked up with NICE actually show when it comes to dealing with asthma. And a couple more questions for the Minister. Now, I do appreciate this isn't her brief, so I'd be grateful if she's able to pass any questions she can't answer on for a letter response. Because we did hear the likes of RSV is really important, these new vaccines that are coming out that cause a huge problem for the elderly and young. And I know that it was introduced between those who are age 75 and 80, but it'd be interesting to see if there's a scope to be able to grow that, to see who else is responsible. And I gather from work done by my colleague on the opposition bench, that there is still some debate and evidence to be gathered of what this would look like. I'd really appreciate if the Minister would take that away. Also, what steps they are taking to increase the uptake of flu and pneumonia vaccinations, because again, prevention is better than cause. And finally, It was mentioned as well that the last government did look at chronic health strategies, and it does appear that the new government has decided to take a different tact when it comes to dealing with chronic conditions. While I appreciate that's prerogative, there is a danger that we could have a lag in terms of how data that has been gathered, research has been looked at, policies that have been structured for the last 5 years or so, could fall by the wayside while we've heard how important and how much of an emergency it is to deal with respiratory conditions. So I'd be grateful if the Minister would be able to clarify whether parties who are interested, who have done work in this, need to resubmit, whether that work is a continuation work within the new structure that the current government is planning. And if there are any timescales on what this would look like, because clearly the Conservative government was unable to get this long-term health strategies in place in time before the election, and time is ticking on with a winter coming up. It'd be really important for these organisations to understand where they stand. And with that, with Christmas coming up, I certainly know from my time, and I declare an interest with my wife being a GP as well, Christmas is the busiest time, and respiratory conditions are one of the top reasons for it. So number one, if anyone is listening out there, to get vaccinated is an imperative, and I would advise everyone to do so. And to the staff within the organisations, we know that they will go above and beyond when they see someone struggling for breath. They will take their time to get that history right, get the medication and treatment in place. And our greatest thanks from this House, and certainly this side of the House, and I'm sure shared by the other side too, for all the work they have done and will do in the Christmas busy period.